Welcome, curious minds, to another deep dive.
Mhm.
Today, we're embarking on a really fascinating journey. We're looking into one of nature's most vital organs, but one we don't often see, the equine placenta.
Yeah, it's incredible stuff.
It's just such a complex structure, isn't it? Uniquely adapted for that long 11-month horse pregnancy. How does it all work? How does that single cell become a foal, powered by this temporary hero?
That really is the core question. This amazing organ, it's entirely fetal, and it acts as the only link, the sole interface, between the mare and her developing foal.
Right.
It handles, well, everything, delivering oxygen, nutrients, taking away waste, even making the hormones needed to keep the whole pregnancy going. It's the foal's first and maybe most important support system.
Absolutely. So we've dug into a whole stack of sources, detailed anatomical stuff, clinical insights, the works.
Hmm.
And our mission, like always, is to give you that shortcut, get you truly well-informed, packed with surprising facts and those aha moments.
Yeah, hopefully demystify it a bit.
Exactly. So get ready. Let's explore this hidden world inside the mare. Okay, so let's unpack this incredible organ. When we talk about placentas, across different species, what exactly makes the equine one so unique? What's its signature, really?
Well, what's truly fascinating is its specific design. It
Yeah.
really sets it apart. First off, it's an entirely fetal organ,
Entirely fetal,
meaning it's built completely by the developing foal. It's not shared tissue contributed by the mare, which is different from some other species.
Okay.
Then its structure, it's categorized as diffuse. Think of it like wall-to-wall carpeting. It covers almost the entire surface of the main fetal membrane, the choriolantua.
Oh.
This creates this huge contact area with the mare's uterus, very different from, say, a cow, where you have distinct attachment points like buttons.
So not just a little patch, but yeah, like that full carpet you said, maximum contact area.
Exactly. And within that diffuse carpet, it's also microcotyledonary.
Microcotyledonary. Okay, break that down.
All right, so it means the exchange surface isn't smooth. It's covered in literally thousands upon thousands of tiny, microscopic, finger-like projections. These are the microcotyledons.
Wow.
And they interlock, almost like microscopic Velcro, with little pockets in the mare's uterine lining, the endometrium. This design just massively increases the surface area for all that vital exchange. Nutrients in, waste out.
That's an amazing amount of surface area for such a big job. Does that intricate connection, that sort of interlocking, ever cause issues? Or is it just pure efficiency?
It's largely a marvel of efficiency, really.
Yeah.
It allows for incredible nutrient transfer, but it also leads to its final unique classification.
Yeah.
It's epitheliochorial.
Epitheliochorial. Okay.
Yeah, and this is where it gets really interesting for the foal's health right after birth. It means all 6 layers of tissue, 3 from the foal, 3 from the mare, they all remain completely intact.
Intact.
Yes, between the fetal blood supply and the maternal blood supply. So unlike in many other mammals, where fetal cells might actually invade or erode the mother's tissue to get closer to her bloodstream, the mare's body maintains this full, respectful barrier. There's no invasion.
So this no invasion policy, what does that ultimately mean for the foal? That sounds like a pretty significant barrier, actually.
It is, and this barrier is absolutely key. It explains a really critical vulnerability for newborn foals.
Okay.
Mares do not transfer antibodies across the placenta to the fetus while it's in the uterus.
Ah, so no immune transfer during pregnancy.
Exactly, which highlights why colostrum, that first rich antibody-packed milk the mare produces right after birth, is absolutely non-negotiable.
Got it.
Without that colostrum, foals are incredibly vulnerable to infections. And it also explains the risk for conditions like neonatal isoerythrolysis.
Oh, yeah, and eye disease.
Right, where the mare's antibodies, if incompatible, actually attack the foal's red blood cells. It can be devastating.
Wow.
And this no invasion thing also means the attachment is at assiduate. It's just a technical term, meaning there's no loss of the mare's uterine tissue when the placenta forms or when it comes out after birth. It separates cleanly, ideally.
Okay, so with all those connections and exchanges happening across that main membrane, the choriolantua, what are the specific parts we should know about? What are the key players in this structure?
Well, the biggest and most important component is the choriolantua. That's the fetal placenta proper.
Right.
It's formed, as I mentioned, by the fusion of 2 fetal membranes. Its outer surface has that characteristic velvety look because of all those microcotyledons.
Uh-huh.
But the inner surface, the side facing the foal, is smooth and glistening. You can see the big fetal blood vessels running across it.
And what about the specific spot where the foal, breaks through at birth?
That would be the cervical star. It's a specific area on the choriolantua, usually pale and smooth-looking, because it lacks those microcotyledons.
Villus, right.
Exactly, a villus. It sits right over the mare's cervix, the opening of the uterus. And it's the normal place where the foal pushes through and ruptures the placenta during birth.
Hmm.
Checking that spot afterwards is really crucial
Why?
to make sure it's intact, that no pieces got left behind in the mare. That leads to problems we'll discuss later.
Gotcha. Okay, what about the immediate wrapping? The clear sac around the foal itself.
Ah, that's the amnion, the innermost membrane. It's surprisingly tough, actually, and transparent. It holds the amniotic fluid and directly surrounds the fetus.
And the foal's born inside that.
Typically, yes. It's born enveloped within the amnion, which it usually breaks through very quickly after birth. Sometimes the mare helps nudge it open.
And the lifeline connecting everything, the cord.
Right, the umbilical cord, often called the funiculus, technically. It's the foal's essential connection to the choriolantua, to the placenta.
Like a superhighway.
Exactly. Think of it like that. It's packed with blood vessels, usually 2 umbilical arteries taking waste away from the foal,
Okay.
and 1 umbilical vein bringing oxygen and nutrients to the foal. Plus, there's the urechus, a tube connecting the foal's bladder to the allantoic sac for waste removal early on, and a remnant of the yolk sac, usually. It's some serious biological engineering in a flexible cord.
You know, as I was prepping for this, a term kept jumping out at me, and it sounded almost mythical. Endometrial cups.
Ah, yes.
They sound fascinating. Can you tell us what these are? Why are they such a unique and important part of a mare's pregnancy?
They really are one of the mare's coolest reproductive quirks. Endometrial cups are truly unique to equids, horses, donkeys, zebras.
Okay.
And they're transient structures. They only exist for a part of the pregnancy, forming early on, starting around day 35 to 38.
And they're not exactly part of the main placenta.
Correct. They're actually formed from specialized fetal cells from the trophoblast layer that form this band called the chorionic girdle. These cells then literally invade the mare's uterine lining, the endometrium.
Invade? I thought you said no invasion.
Ah, good point. This is the exception. These specific cells do invade, but it's a controlled, localized invasion just to form these cups. It's very different from the general placental attachment.
Okay, so what's their big job then if they're not directly involved in nutrient exchange?
Their primary function is hormonal. They secrete a very powerful hormone called equine chorionic gonadotropin, or ECG. You might also hear it called PMSG, pregnant mare serum gonadotropin.
And ECG does what?
It's critical because it acts on the mare's ovaries. It stimulates the formation of extracorporeal lutea, or CLs. We call these secondary CLs.
And CLs produce progesterone, right?
Exactly. So these secondary CLs pump out a whole lot of extra progesterone. And that progesterone is absolutely vital for maintaining the pregnancy during those crucial first few months before the placenta fully takes over hormone production.
Wow. So it's like a temporary booster shot for pregnancy hormones.
That's a great way to put it. And what's also fascinating is the fate of these cups. Because they're made of fetal cells, the mare's immune system eventually recognizes them as foreign.
So it attacks them.
Sort of, yes. It mounts an immune response, and this leads to the cups naturally breaking down, undergoing necrosis, and sloughing off around day 70 to 120 of gestation.
And that's normal. Doesn't harm the pregnancy.
Completely normal. And it doesn't affect the ongoing pregnancy at all. By that time, the main placenta has developed enough to produce sufficient progesterone itself. So the cups do their job and then make a graceful, immunologically mediated exit. It's a really clever temporary system.
That is truly fascinating. Okay, so we have the components, we have these unique cups. How does this whole complex organ actually develop over that long 11-month stretch? It sounds like it has to be a very precise process.
It absolutely is a precise and dynamic ballet of development.
Mm.
So after fertilization, the little spherical embryo travels down the oviduct and enters the uterus around day 6 or 7.
Okay.
And then it does something remarkable. It stays mobile. It actually travels all around the entire uterine lumen, bouncing from horn to horn until around day 16 or 17.
It just wanders around. Why?
It's crucial. This early mobility is thought to be the primary signal to the mare's body that she is pregnant. It stimulates the uterus to release signals that prevent the normal cycle from restarting. Without that movement, the pregnancy might fail very early.
Wow, okay, so it moves around, signals pregnancy, and then...
And it fixes. It stops moving and settles, usually at the base of one of the uterine horns. It doesn't implant yet, it just becomes immobile.
And that's when those unique endometrial cups start forming.
Exactly. That specialized band of fetal cells, the chorionic girdle, forms by about day 25. Then, around day 35 to 38, Those girdle cells perform their localized invasion to form the endometrial cups.
Which pump out the ECG until day 120 or so.
Right, roughly day 120. Meanwhile, the actual attachment of the main placental membrane, the atlantochorion, to the uterine lining starts around day 40. That's when those first little microvilli begin to develop.
Okay.
Then the placenta just continues to mature and get more complex. The microcotyledons fully develop, that intricate interdigitation locks in. This goes on until about day 150, maybe 5 months.
And after day 150?
After that, the basic structure is pretty much established. It mainly just grows in size, expands its surface area to keep up with the rapidly increasing nutritional and oxygen demands of the growing fetus for the rest of the gestation.
It's incredible how orchestrated it all is. Now, this organ is clearly so vital. So when things go wrong, when this intricate system faces challenges, what happens, and why is looking at it after the foal is born so incredibly important?
That's a really crucial point. Examining the placenta right after foaling, it's not just, an afterthought. It's a critical diagnostic step.
For both the mare and foal.
Absolutely for both. Any abnormalities you find on that placenta can be silent signals. They can tell you about problems that happened during the pregnancy, potential issues the foal might be facing right now, or even risks for the mare or future pregnancies.
Okay, so what are some of the common and maybe most serious problems veterinarians look for?
Well, one really serious issue, and it's a common emergency situation, is a retained placenta.
Meaning it doesn't all come out.
Exactly. It's defined as the failure of the mare to completely expel the entire choriolantoire, that whole carpet structure, within about 3 hours of foaling.
3 hours, okay. And why does that happen?
It can happen for a few reasons. Sometimes it's uterine inertia. The uterus is just tired after foaling and doesn't contract strongly enough to push it out. It can also be linked to dystocia, a difficult birth, or sometimes to things like fescutoxicosis.
Fescutoxicosis from grass.
Yes, from a fungus that can grow on tall fescue grass. It causes various problems, including retained placentas. And the piece that most often gets stuck, retained, is the very tip of the non-gravid horn, the horn that didn't carry the foal.
And why is that an emergency? What's the risk?
It's a huge risk. That retained tissue inside the warm, moist uterus starts to break down, necrosis, very quickly. It becomes an ideal breeding ground for bacteria.
Oh boy.
This leads to a severe uterine infection, metritis. Bacterial toxins get absorbed into the mare's bloodstream, which can cause systemic illness, endotoxemia, and very commonly, a devastating complication called laminitis.
Laminitis founder from a retained placenta.
Absolutely. It's one of the most common and feared consequences. If it's not treated quickly and aggressively, the mare can develop septicemia and even die. So retained placenta is a true emergency.
Okay, that's incredibly serious. What else? What other major concerns are there?
Another major one, and probably the leading cause of pregnancy loss in horses, is placentitis.
Placentitis. Itis means inflammation, right? So inflammation of the placenta.
Exactly. Inflammation, or more often, infection of the placental membranes. And its consequences are tragic. It can lead to abortion, premature delivery, or the birth of very weak, compromised foals that might not survive.
How does that infection typically get started?
The most common route is ascending placentitis. Bacteria, often common environmental bacteria like Streptococcus equizoepidemicus, travel up through the mare's vagina and cervix.
So from the outside in.
Yes. They colonize and infect the placental membranes right near the cervix, usually at that cervical star area we talked about. So when you examine the placenta after foaling, you'd look for signs. They're thickening, discoloration, maybe a pus-like discharge, exudate around cervical star.
Are there other types?
Yes. There's also something called nocardioform placentitis. It involves specific types of bacteria, often nocardia or related species, and causes characteristic thick, brownish, mucoid lesions, but usually deeper in the uterus, maybe at the base of one of the horns or in the uterine body. It looks quite different. And less commonly, infections can reach the placenta through the mare's bloodstream bacteria, or viruses circulating systemically can sometimes lodge in the placenta and cause more widespread diffuse lesions.
Does the mare show signs if she has placentitis?
Sometimes, but not always reliably. She might show signs like premature udder development, bagging up too early, or maybe some vulvar discharge. But often the signs are subtle or absent until, tragically, there's a problem with the pregnancy or the foal itself.
And the ultimate impact on the foal when placentitis strikes. It's devastating, really. The inflammation damages the placenta, making it insufficient. It can't do its job of supporting the foal properly.
Right.
This leads to fetal growth retardation. The foal doesn't grow as it should. It can trigger abortion or premature birth. Or the foal might be born alive but weak, septic, meaning bacteria in the bloodstream, or dangerously premature. Survival chances can be low. That's heartbreaking. What about the umbilical cord itself? Can that cause problems too?
Yes, definitely. The umbilical cord can have its own set of issues. Normally, it's around, say, 60 to 83 centimeters long, maybe 2 to 3 feet, and it naturally has a few twists in it.
Okay.
But abnormalities can occur. Excessive torsion, meaning it gets twisted too many times, maybe more than 5 or 6 full rotations, can actually act like a tourniquet.
Oh, no.
Yeah, it can constrict the blood vessels inside the cord, cutting off blood flow, leading to fetal oxygen deprivation, hypoxia, and sadly, often death. Cords that are unusually long, say over 80 or 90 centimeters, are just physically more prone to getting twisted like that.
And short cords.
Very short cords, maybe under 30 centimeters, can also be a problem. They can put too much tension on the placenta during late gestation or birth, potentially causing it to separate prematurely.
Any other cord issues?
You can also sometimes see edema, swelling, or hemorrhage, bleeding within the cord itself. And phoenicitis, which is inflammation of the cord, is usually seen alongside placentitis, particularly the ascending type.
Okay, so lots can go wrong there too. Now, what about something that sounds really dramatic? A red bag delivery. I've heard that term, and it sounds like an emergency.
It is terrifying, and yes, it's an absolute time-critical emergency for the foal.
What is it exactly?
Premature placental separation, which is commonly called a red bag delivery, is when the chorioallantua, that outer placental membrane,
The velvety red one.
yes, that one, it detaches from the uterine wall before the foal is actually born, before it's out of the birth canal. So what the person attending the birth sees is that intact, velvety, bright red sac appearing at the mare's vulva, often before they even see the foal's feet or nose.
Instead of the whitish amnion.
Exactly. Normally you see the whitish amnion first. Seeing that red bag means the placenta is separated prematurely. This can be triggered by things like, again, fescue toxicosis or severe placentitis or other stressors.
Why is that so bad?
Because the moment that chorioallantua separates, the foal loses its oxygen supply. Blood flow through the umbilical cord is cut off or severely compromised because the connection to the mare is gone, but the foal is still trapped inside.
Oh, wow.
It's suffocating.
Yeah.
So rapid, immediate intervention is required. Whoever is there, owner, farm manager, vet, needs to recognize it instantly, rupture that red bag manually and quickly, and help deliver the foal as fast as possible. Every second counts to prevent brain damage or death.
That really underscores how vital that placental connection is right up until the very last second.
Absolutely. It's the foal's only source of oxygen until its lungs can take over.
So, okay, given all these potential problems, all these stories the placenta can tell, how do vets actually examine it after the birth? What's the standard procedure?
Well, a thorough placental exam should really be standard practice on every mare after every foaling. Ideally, you want to do it pretty soon after it's passed, maybe within 30 to 60 minutes.
And step one.
Step one is to lay it out carefully on a clean surface. You want to arrange it in an F or Y shape, trying to mimic how it sat inside the uterus.
Okay.
You identify the horn that held the foal, that's the gravid horn. It'll be larger. The other horn, the non-gravid horn, and the main body section connecting them. Get it oriented correctly.
And once it's laid out like that, what are the key things you're checking?
First and foremost is completeness. You have to meticulously inspect the entire thing, especially the very tips of both horns.
Because pieces can be left behind.
Exactly. You run water into it or just visually trace all the edges to make sure no fragments are missing. The tip of the non-gravid horn is the most common place for a piece to tear off and be retained in the mare.
Right, which we know is an emergency. Okay, so completeness first, then what?
Then you weigh it. A normal, healthy equine placenta should weigh roughly 10 to 11% of the foal's body weight.
So you need to know the foal's weight too.
Ideally, yes, or have a good estimate. If the placenta is significantly heavier than that 11% mark, it's often a red flag.
Indicating what?
It usually indicates edema, excessive fluid retention, which can be caused by things like placentitis or fescue toxicosis, or it could indicate significant inflammation and thickening from infection. An abnormally heavy placenta is almost always a sign of trouble.
Okay, completeness, weight. What other specific abnormalities jump out during the exam?
You do a really close visual inspection. On the outer velvety chorionic surface, you're looking for any areas of discoloration. Is it pale? Is it dark? Is it brownish? Any thickening, any exudate, that pus-like material. Any areas that are bare, lacking those villus areas, especially around the cervical star region.
Checking for signs of placentitis mainly.
Exactly. Then you flip it over or examine the smooth, glistening inner allantoic surface. You look at the blood vessels. You check the umbilical cord again, measure it, count the twists, look for swelling, bleeding, signs of inflammation like funicitis.
Uh-huh.
Finally, you look closely at the amnion, that inner sac. You're looking for meconium staining.
Meconium, that's the foal's first manure.
Yes, if the amnion is stained yellow or brown or green, it means the foal passed meconium while still inside the uterus. That's a strong indicator of fetal distress at some point before or during birth.
Got it.
You also check the amnion for any unusual tears or signs of inflammation, amnionitis.
And if you find any of these significant
And
abnormalities,
it's really important to consider submitting samples, or sometimes even the whole placenta, to a veterinary diagnostic lab. They can do histopathology, look at the tissue under a microscope, run cultures for bacteria, or test for viruses.
why is that extra step important?
It helps confirm a diagnosis, which is crucial for guiding the right treatment for the mare, especially if there's infection or retention risk. It also helps determine the prognosis for the foal if it survived. And importantly, it provides vital information for managing future breeding attempts for that mare. The placenta really holds the history of the pregnancy.
Wow. What an incredibly deep dive into an organ that, yeah, does so much crucial work completely behind the scenes. We've really unpacked a lot today.
We have.
Everything from its unique structure, that diffuse epitheliochorial design, to the really cool transient role of the endometrial cups.
Yeah, those are amazing.
And underscored the absolute critical importance of that post-foaling exam for checking on both the mare and her new foal.
Hopefully everyone listening feels much more well-informed now
Yeah.
about this truly vital yet often overlooked organ in horse health. As we've seen, that placenta tells a story. It really does. It holds invaluable clues about the entire pregnancy.
Absolutely. So next time you hear about a foal being born, maybe take a moment to consider that invisible, complex journey that happened inside the mare, the journey that shaped its very first moments, and maybe ponder this final thought. If the equine placenta has evolved these unique features specifically for the horse's reproductive strategy, what fascinating specialized adaptations might the placentas of other mammals, whales, bats, primates, you name it, reveal about their own unique ways of bringing life into the world? The story of life truly begins with this remarkable, often unsung hero.